Did you know that 1 in 2 women and 1 in 4 men over the age of 50 will break a bone due to osteoporosis? Now, if that happens to be a hip fracture, there's a 25% chance of death in the first year of recovery. Now, this is why osteoporosis is so significant and important. You need to understand the diagnosis, how to manage it, how to prevent it, the risk factors associated with it, and what you can do to improve your health. Let's dive in. So what exactly is osteoporosis? It's a metabolic bone disorder that's systemic, so it means widespread throughout the body, and it affects each and every bone. It happens when your bones lose density and they lose mass, and the little crosslinks, the little scaffolding inside the bone, they become weaker, which makes you more susceptible to a fracture. Think of the scaffolding, the structure as crosslinks, where the more makeup of that is going to make the bone reinforce and make you less susceptible to a fracture. Where there's less, and which happens with age, biological aging, we get depletion of that. These scaffolding becomes weaker and the bones are more at risk of a fracture. Now, the remodeling process, it's common from a very young age where we get layers and layers and remodeling of bone being rebuilt, because essentially we have these cells inside the bone. They're called osteocytes, osteoblasts, and osteoclasts. Now with the osteocytes, they detect the movement that's happening on the bone. So imagine a child who's jumping lots or an adult where there's bowing and impact on the bone. These sites are detecting that and sending chemical signals to cause a physiological process. The cells that lay down new bone are called osteoblasts. They think of them, the B for building, or osteoblasts for building blocks on top. And this relayers and improves the bone structure. Now the osteoclast is needed, but the detrimental side to them is essentially they wipe away or they dissolve the bone tissue, the matrix that is there, and they slowly get rid of that. Now that's a good thing when you are younger because it removes the old dead bone tissue, and then the osteoblasts remodel and lay down new tissue and new tissue. We have more osteoblasts than osteoclasts when we're younger and mid-age. However, once we get older and we go through menopause or andropause or testosterone and estrogen deficiencies, we have more osteoclasts than osteoblasts. So let me show you what happens to your bone when osteoporosis develops. As you can see inside, the structure, the honeycomb structure, is dense and strong in a normal bone. But in osteoporosis, the bone density decreases and it makes these bones more prone to fragility fractures. So who's at risk for osteoporosis? Well, it depends on many risk factors, which we like to break them down into modifiable and non-modifiable risk factors. Now, the non-modifiable risk factors are things we can't control. It's age, it's our genetics. These things matter because as we turn over age 50, we go through menopause or we lose testosterone, our age slowly starts to decline all our organs. Now, with this impairment, the bone remodeling isn't as strong and we don't get the osteoblast formation with age. The genetic side of things is something we can't control. It's inevitable. Imagine a child who grows tall because of their parents being tall. The bone length is growing because of genetics. Bone mass, bone density is slightly different, which is still being heavily researched, but there is a highly genetic component to it where if your mum or your dad has had a hip fracture, a parental hip fracture, there's a high chance it puts you at a greater risk of osteoporosis and a hip fracture. Now, the reason women are at greater risk is because as they go through menopause, they get depletion in estrogen and progesterone. This hormone is required to stimulate bone remodeling processes. However, as we go through menopause, there's a big physiological process where that is not as effective. We'll go through another video at another point talking about the modifiable factors because they need to be broken down to significant parts. Think of modifiable factors as your diet, your lifestyle, your physical activity, your footwear, your intrinsic risk factors for having a fall, balance, strength, power, all these other muscular characteristics which contribute towards preventing a fracture and preventing accelerated loss of bone. To break it down briefly, in the dietary side of things, a diet low in vitamin D and calcium, magnesium, protein are all significant factors which will contribute to accelerated bone loss. Lack of physical activity and lack of strength training leads to further bone remodeling breakdown process because there's not enough stimulus to those bones to regenerate that same process. Now, what's important about that is getting a progressive exercise program where you're able to build up bone and build up your power, your strength, your endurance so slowly. So the muscular characteristics support the scaffolding of the bone and you're able to then improve and build further bone. However, the downside is that bone is very adaptive. Once we get used to a certain stimulus, the bone remodeling process is not an gradient osteoblast activity. So think about a walking or a non-weight bearing exercises such as swimming, cycling, general brisk walking, non-weight bearing exercises like floor Pilates. These exercises are great for physical, cardiovascular health and general exercise. However, in terms of aiming to build bone and remodel, that is not as effective. The reason being is because there's no weight bearing impact on the bone. There's no muscular forces that are greater demand on the bone compared to exercises where we have additional load, additional force such as lifting, pressing, pulling, squatting, deadlifting, all these movements which then affect our bones in a more progressive and physiological manner. Now, osteoporosis is often called a silent disease. It's because nothing is known about it until a fracture occurs. Opposite, it might be in heart disease or cardiovascular health, where we have symptoms of high blood pressure and then we can do more about it before a heart attack or myocardial infarction occurs. The downside of osteoporosis is that we don't know about it through our bones until a fracture occurs. Now, this is common because a lot of patients that I see will have had a hip fracture, gone to the hospital, had a repair, and then they go get a bone density scan, finding out they've got osteoporosis. Here's some medication, now let's be proactive. But what if we could prevent that and go for earlier screening? So I have 3 risk factors I want you to pay attention to, as these are important for anyone who's over the age of 50 who may be at risk. Firstly, this is not medical advice. Once again, I highly advise you talking to your doctor, or your physio, or your healthcare practitioner before diving into this. However, number 1 is a reduction in height. If you have noticed a significant reduction in your height over the year, it is important to get a follow-up DEXA scan. 2 is a noticeable hunch, where you've got a hypokyphotic hunch, or your pronounced curve is called hypokyphosis, which is quite common in bones as a decrease on the front of the bone, which causes us to curve over, or it could be due to a compression or wedge fracture in your spine. The 3rd is sudden unexpected back pain, which could have occurred due to a fracture. It is worth investigating these 3 signs and symptoms if you suspect any of them over the past year. So let's talk about managing it and preventing it. The first part I would recommend is getting a DEXA scan. You need to get a baseline to see where you're currently sitting. I have patients who are currently doing them in their 30s or the 40s if they know their parents had significant osteoporosis. This is quite often a common thing, and I highly recommend the younger population starting to get them despite the low radiation risk. Now, what is important for you is to get a DEXA scan, find out where your baseline sits, and then you can act upon that. The DEXA scan can also assess for vertebral fracture, and so I highly recommend DEXA scan, REMS technology. These advancements in technology that are now available, simple, painless, might leave you $100 or $200 out of pocket or covered through the Medicare system. It's highly worth investigating. From here, your doctor may prescribe you medications, and it's worth having a chat to one GP and maybe even a second opinion or an endocrinologist as a specialist, talking to them about your medication options. If you're at high risk, it is often highly advised to take a bone building medications like bisphosphonates or hormone replacement therapy or other medications that may assist in your bone replacement therapy. Now, my favorite area is the diet and exercise area, and that's where I research and provide clinical assistance to my patients as a non-pharmaceutical approach. This is not to say don't take the medication. This is more to work with it to have the best overall and effective outcome. Now, once again, I provide exercises for this in another video, although to get started, your best bet is doing weight-bearing exercises, resistance and strength training exercises. This can be using a band, this can be pushing weights, this can be pulling weights, this can be jumping on the spot, you can be doing your squats. These are all weight-bearing compressive exercises that loads our skeleton, which is good for our bones. To replenish what we use during this exercise session, the diet is important. Now, my favorite thing to reinforce is the higher protein intake. Nutrition is in the super important side of it because you want to replenish what we use during the exercises. Eating foods rich in vitamin D, calcium, magnesium, and protein are crucial bone remodeling process. I'll do another video on this highlighting foods best for osteoporosis, although for now, work what's in your favor. A lot of other people have celiac issues, Crohn's, gut malabsorption issues, and it's best to consult with someone to help you with your individual case. Although to get you started, foods high in natural protein, eggs, meats, white meats, fish, Greek yogurt, milk, dairy, they are higher foods in calcium and protein, are great for you. So if you're looking to prevent osteoporosis or manage it, I've got 5 simple tips for you that are going to help you along this journey. The first is getting enough vitamin D and calcium. For calcium, you want around 1,300 milligrams a day through natural sources. If you can't consume this through natural, then dietary supplement is advised. Vitamin D is the other side. If you can't get enough vitamin D through synthetic natural light, then sourcing that through a supplement is also recommended. 2000 IU is highly recommended for vitamin D intake daily. Number 2 is staying super active. Ideally, you want to be doing the strength progressive resistance-based exercises 3 times a week. There are 3 is quitting smoking and alcohol. If you cannot quit cold turkey straight away, then it is advised to slowly get on a process where you can cut it out of the lifestyle. Number 4 is prevent falls. As we age, it becomes a bigger risk. So making sure the home environment or outdoor environment, simple things like removing trip hazards, not leaving stuff around, and ensuring you have have proper footwear are beneficial for your falls risk. Number 5 is regular checkups. Other health professionals might recommend let's put you on a watch for 2 to 3 years and see how you go. I highly recommend you stay proactive and reinforce to get checked every year or every second year and stay on top of it with your healthcare professional. Remember, osteoporosis doesn't have to control your lifestyle. So start today. Talk to your healthcare professional to find out what dietary intake and what physical activity you should be doing to improve your bone density, as it's never too late to start. Once again, thanks for joining. We'll see you next time.